be subscribed for regular updates from the health department. Destacar en español brevemente, los que están en alto riesgo realmente son nuestros adultos mayores. Ha habido casos de jóvenes, sí, pero tienden a ser casos muy leves. Por eso la ciudad hoy ha anunciado que todo neoyorquino adulto mayor o los que tienen ya condiciones de respiratorios deberían evitar grupos grandes. Eso se anunció hoy mismo. Se trata solamente de nuestros adultos mayores y para los demás, si no nos sentimos bien, deberíamos evitar contacto o visitar a los adultos mayores o a los que tienen síntomas ya de problemas respiratorios. Y usted quiere más información acerca de todos estos temas, pueden inscribirse para alertas a través de texto, mandando la palabra COVID, C-O-V de vaca y D, al número 692-692.
Muchas gracias, concejal. Thank you so much, council member. Now we're going to hear from our local councilwoman from right here in East Harlem, because I hope all of you throughout the 13th Congressional District are tuning into this very important program where we're going to be listening to your questions about this crisis. And East Harlem is also part of our district, so is Harlem, Hamilton Heights, Washington Heights, Inwood, Marble Hill, the Northwest Bronx, Manhattan Valley, the Central Harlem. These are all the neighborhoods, Sugar Hill, all the neighborhoods of this district, the 13th Congressional District. And the local councilwoman right here that represents East Harlem, where the Manhattan Neighborhood Network studio is housed, is our great friend, Diana Ayala.
Thank you, Congressman, for having this town hall today. It's really important that we get out information in real time to our constituents. But I'm also the chair of the Committee on Mental Health, Disabilities, and Addictions, and so I'm really concerned about the mental well-being of our communities. I understand, and it's understandable that people are feeling a high sense of anxiety. We don't know this virus is new, and when we don't know what something is, it creates a little bit more of anxiety, of the uncertainty of the unknown. And so we just wanted, to ensure that you understood, and I wanted to give an example. In my household, there are 7 of us. My dad is one of the 7, is very ill, and he would potentially be very, very sick if he contracted the coronavirus. But the majority of the people in that household would not. And I think that, we need to understand that. We need to practice good hygiene. We need to really arm ourselves with the facts. But if you're still feeling a sense of anxiety, even after hearing all of the facts, that's normal too. It's normal too. We're being fed a lot of information. There's a lot of misinformation. Some things we just don't know. Please, 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 feel free to contact somebody, speak to somebody. This afternoon, the mayor had a press conference, and they alluded to this as well. You can contact 1-888-NYC-WELL if you need to speak to somebody. We all feel, anxious at times, and sometimes we just need somebody to help us kind of work through those feelings. Yo soy Diana Ayala, la concejal de aquí del distrito 8, representando el barrio y el sur del Bronx, pero también soy la chair del Comité de Salud Mental, y estoy un poquito preocupada, estamos preocupados porque entendemos que las personas pues están ansiosas a no saber lo que es este virus, en verdad, de poderlo entender de una manera que no cree el nivel de ansiedad que está creando. Y queremos que ustedes sepan que si practicamos buen hygiene, como se dice, Mark, en español, y nos lavamos las manos frecuentemente y aseguramos de que si estamos en contacto con una persona que esté enferma, de limpiar la área donde una persona a lo mejor estornude sin querer, que estaremos bien. Pero en casos que todavía siente esa intensidad de ansiedad, que es súper normal, que todos lo sentimos, y que por favor recojan el teléfono y llamen al 1-888-NYCWELL a New York City Well, y puede hablar con un profesional sobre lo que está sintiendo, y probablemente le hará sentir mejor. Pero también quería reiterar que si tiene alguien en la familia que es enferma, en mi familia, por ejemplo, mi papá está bien enfermito, es bien delicado de salud, y somos 7. Si en mi casa llegara a llegar el corona, la mayoría de las personas que viven en esa casa se enfermarían un poco, pero estarían bien. Mi papá, tenemos que tener un poco más de cuidado. Entonces yo les he instructado a todas las personas que conocen que por favor, si se enferman, no vayan a mi casa. I have already instructed all of the people in my family that if they are sick, that they should not come to my household. Not because I'm afraid for the rest of us, because I think that, like, as I said before, most of us will be fine, we'll get sick, we'll get better, but because of concerns of my father who happens to have a compromised immune system. So please, if you know somebody, if you're caring for an elderly person, if you're caring for somebody who's very sick, be mindful of that because that's very critical.
Thank you, Councilwoman. Why don't we go back to those numbers, Mark and Diana, so the general public will know the two numbers that you...
Okay, well, so for our new text alert system, where you can get real-time updates, you text the word COVID, COVID, to 692-692.
En español ahora.
Sí, para recibir alertas acerca de esta crisis del Departamento de Salud, usted puede mandar un texto con la palabra COVID, C-O-V de Víctor, I-D, al número 692-692.
Y Diana, por favor, si puede.
¿Necesita hablar con alguien? El número es el 1-888-NYC-WELL. If you need to speak to a mental health provider, the number is 1-888-NYC-WELL.
Thank you. I think that's very important for the general public to know. Eso es muy importante que el público en general sepa realmente dónde llamar. Vamos ahora a escuchar de nuestra asambleísta del Alto Manhattan, Carmen de la Rosa. Let's hear from Assemblywoman Carmen de la Rosa.
Thank you, Congressman, and thank you to all the experts that are here. The point of this town hall is to make sure that our communities are informed. We just came back from Albany, where Governor Cuomo has already declared a state of emergency. And the reason it's a state of emergency is because this is a serious situation. But that should not incite panic in our communities. As you heard from the experts, if you're someone who's relatively healthy, you should be okay. We are looking to make sure that people who have compromised immune systems or are vulnerable, either elderly or sick, take care of themselves. As they all said, hygiene is very important. I also want to make emphasis on employers and small business owners. Please make sure to accommodate your staff, and there is help from the state government and the city government to make sure that small businesses have the resources to make sure that their staff can take care of themselves. If they're feeling sick, we have paid sick leave in the state of New York, and we want to make sure as well that people who are underinsured or uninsured also seek information in order to get the treatment that they need should they become sick. So for me, it's a pleasure to be here, and we are here simply to inform our communities. Our offices are also available to seek information. You can visit my office at 210 Sherman Avenue or call my office at 212-544-2278. But again, if you're feeling sick, the first call should be to your healthcare provider, your primary doctor, and you should be receiving information from there. En español, soy la asambleísta Carmen de la Rosa. Acabamos de retornar de Albany, donde el gobernador Cuomo ya ha dicho que estamos en un estado de emergencia. Entiendan que es una emergencia porque la situación es seria, pero no debe de haber pánico en nuestra comunidad. Si usted es una persona que está saludable, normalmente no va a necesitar hospitalización por este virus. Si eres una persona que tiene un sistema, que tiene una enfermedad, entonces sí, debe de estar en alerta. El higiene es importante, como dijeron todos nuestros expertos. Y también quiero alentar a los pequeños negociantes, a los dueños de negocios y a las personas que trabajan en industrias de servicio. Recuérdense que en el estado de Nueva York tenemos la ley que le permite a usted tomar tiempo para si tiene una enfermedad. Invoque su derecho. Si está enfermo, no tiene que ir a trabajar. Hable con su empleado. Y a los pequeños negociantes hay recursos para ustedes también, para asegurar que el equipo laboral tenga salud y pueda seguir trabajando. Así que por favor, recurra a nuestras oficinas, venga y visítenos o llame a nuestras oficinas si necesitan más información. Y sobre todo, si está enfermo, la primera llamada debe ser a su médico primario. Gracias.
Gracias, Carmen. Now let's hear from our good friend, Assemblyman Al Taylor. After he speaks, we'll take questions from the audience. Vamos a escuchar de nuestro asambleísta Al Taylor Después que él termine, entonces vamos a coger las preguntas que ustedes tengan a los panelistas o a cualquiera de las personas que están aquí. Assembly member, please.
Thank you, Congressman, for bringing us together. I want to thank the experts for being here on the panel this afternoon. And for my New Yorkers, my fellow New Yorkers, it's important that, one, we remain calm. And the information is available. Get it from a reliable source such as here. The information that you're receiving tonight, please share it with your loved ones. You're getting information firsthand. It's authentic. Please share it. Direct people where they can get the information. As my colleague said, if you need to stay out of work, there are ways that you can get paid for that. But right now, do the smart thing. Be mindful, be kind to people. We don't know who is or who is not, but don't assume someone has something just because. But be careful and be extremely attentive to the needs of the elderly in our homes, in our buildings, those that we may see in our employment. And again, I want to thank this panel. Thank you, Congressman, for bringing this together. And my office number is 212-234-1430, and I'm located at 2541-55 Adam Clayton Powell, and someone will translate this for me, I hope.
Okay, thank you, Assembly member. Now let's see if you have any questions for the panel, for any of the elected officials. This is the time to do it. Si tienen algunas preguntas de los panelistas, de los oficiales electos, ahora es el tiempo para que la puedan hacer y así pueden salir informados de este foro virtual aquí en Manhattan Neighborhood Network. ¿Preguntas? Questions?
Yes, Keith Lilly here. Thank you, Congressman, and the panel for this discussion. I'm going Facebook Live, and someone asked, what are the risks for people that suffer from cancer or on remission?
¿Cuáles son los riesgos de las personas que sufren de cáncer y están en remisión, que no están activos ahora? What are the risks for cancer, folks that have cancer and are on remission right now? Any of the doctors?
I can take it, at least at the beginning. It's any condition that affects your immune system. It's something to watch for. Also, if you are young and you have nothing else, is much less troublesome than if you are over 50 or 60 and you've been in remission, but through a lot of chemotherapy sessions, your immune system gets really compromised.
Okay. Any questions, preguntas de los televidentes, de las personas que están sintonizando, or any additional questions that people that are tuning in should have? Let's continue to speak as we wait for other questions. Dr. Ho, could you speak about the potential treatment for the vaccine? What's the timetable? What's the research is occurring right now? Where are we with that? What can people expect regarding treatment?
Okay. Well, at this moment, there's no known effective therapy or vaccine for COVID-19. And research to develop new treatment or prevention methods is just starting. Normally, to develop these things, we typically go through a timeline of 5 to 10 years. But with this emergency, I think there's a major effort trying to contract that timeline down as much as possible. But even if we find something today that it seems to be effective against the virus in the laboratory, it takes many months to test it in animals, to manufacture it, and then to retest it for safety in various. So it's pretty clear that nothing short of a year is likely. Most likely it's going to take 18 months or more to have any real therapy that could be applied to patients.
Thank you so much. And what about Dr. Tapia Mendoza? What about the children that you have? I know that you treat children with asthma, and your practice is well known to provide great services for children, asthmatic children. What do you have? What suggestions do you have for parents?
Our first suggestion is that people should be aware that fortunately the coronavirus in children up to this point has been very, very mild. And most kids that present coronavirus infection, most of the time we don't even know since it's so mild. But Every time we get a patient in the clinic, they're accompanied by an adult. And many times they come in with older adults, the grandmothers or other family members, and these family members can have serious underlying conditions. Kids that suffer from asthma, as well as adults that suffer from asthma, are more prone to get complications from any infection. Not only the coronavirus, but also the influenza virus, which has been very active this past season. So our recommendation is, if your child is sick, first call your primary care provider, discuss the symptoms, and we can guide you on the steps that you can take to take care of yourself and your family.
Can I say something on the schools, which I'm getting a lot of questions about? Parents are worried, should we send our children to school? And the health department has made a very clear recommendation that kids should still go to school unless they themselves are feeling ill, in which case, to protect other kids from risk, they should stay home. They're evaluating that hour by hour, but there have not been confirmed cases amongst public school kids. There's a really intense program now in place where school custodians are cleaning and disinfecting schools more intensely, more deeply, more regularly than before as a precaution. But the health department clarified today that even for children who may have asthma and might feel that they're a little bit more compromised, there's no recommendation at this time that they avoid public school. You know, if we close the schools, there are kids who won't get meals that they rely on, lunch and breakfast. We have nurses in our schools that are important for kids to have access to. And if we close the schools, there'll be many families who won't have child care. So closing of public schools is not a decision that would ever be made lightly. And again, the recommendation as of now from the experts is there's no reason to keep your kid home from school. And in fact, attendance has been even higher than this time last year.
Thank you, Councilmember. We got another question from Keith Lilly. Yeah, well, we have one here on the teleprompter. How well are we prepared at our hospitals? And are those enough kits and masks for health? Are there enough health kits and masks for healthcare professionals? And how are the hospital prepared? That's the question.
You can probably take that.
So I can probably start with that. We have been working intensely, not only with the public hospital systems at health and hospitals, but also with all the voluntary hospitals. We have identified already 1,200 isolation beds in case we need them. And these are beds that are not being taken from other patients for other serious conditions. We have an entire protocol on what would happen if we need to surge, if we end up having cases in the hundreds or more. And we will just go through decreasing the elective surgeries and decreasing the outpatient side. So all those resources go to take care of the people
So what
who are
about the
more
masks,
serious.
though? I think people have a question about how effective are they? Are they effective? What kind they should have?
So there are, in general terms, two kinds of masks that relate to this topic. One is a regular surgical mask, which is not necessarily very effective with this type of virus. And the other one is the N95 mask that has to be fit tested. And we're really saying there are two main applications for those very specialized masks. One is for the healthcare providers who are going to be in constant contact with these patients and other patients, and for those who are confirmed cases, who are exhibiting severe symptoms, but to protect others so they don't get infected. Is not. We've been discouraging the use of masks in the subway or in general part because, in fact, is when you put on a mask is because you're infected and you're trying to protect others.
¿Puede traducirlo a español, por favor?
Sí, en cuanto a los hospitales, tenemos una respuesta y un protocolo bastante elaborado en que no solo se incluyen los hospitales públicos, sino también todo el sistema que en Nueva York, el sistema de hospitales, el sistema de salud es uno de los mejores del mundo. Entonces, tenemos todo un protocolo para asegurar que todos los pacientes, sobre todo casos serios, sean vistos. Hemos identificado 1,200 camas en aislamiento que son especiales para casos de emergencia con el virus corona. Y en cuanto a las máscaras, hay dos tipos. El tipo de máscara que se usa en cirugía, que es el más común, y otro que es más especializado, que es el N95. El N95 es el indicado para el caso del virus corona. Solamente se recomienda para dos tipos de situaciones. Para las personas que trabajan en hospitales y en el sector salud, que van a estar en contacto constante con pacientes, no solo afectados por esto, sino también en general, y para los pacientes que son confirmados y que se ponen la máscara para impedir la transmisión a los demás. Entonces, hemos dicho varias veces que las mascarillas no protegen al que lo usa, sino que se usan para que el que lo usa no infecte a los demás.
Another question, what is being done to address the cruise ships entering cruise terminals like the Brooklyn Cruise Terminal in Red Hook? ¿Qué se está haciendo para tratar temas de los cruceros que están entrando a los terminales de la ciudad de Nueva York? Any information regarding the cruise ships?
I guess I can take that one too.
Yes.
I think we are developing protocols with every city agency dealing with small businesses, with cruise ship, with economic development, with housing, etc. The idea is that if we know, and we did about 3 weeks ago, that a cruise ship has any indication of a potential infection, then there is a protocol in which they stay out of anchoring, and there's an evaluation team that goes and makes sure that everything is okay. We had a situation with a cruise ship that ended up actually going to New Jersey, so we really didn't have to deal with any of that.
Okay. Does getting the pneumococcal vaccine and regular flu vaccine help avoid complications? Si usted consigue la vacuna del flu o otras vacunas relacionadas con este tipo de enfermedades, puede ayudar con las complicaciones. ¿Cualquiera? Anybody? Doctor?
We do see a lot of patients that, for one reason or another, refuse to get the influenza vaccine because of myth that the influenza vaccine causes the illness. So a lot of patients and a lot of our community people refuse the vaccines. But both vaccines can protect against very severe diseases, but unfortunately they do not protect against the coronavirus.
¿Puede decirlo en español, por favor?
Nosotros tenemos muchos pacientes en nuestra comunidad que le tienen miedo a la vacuna de la influenza por los mitos que existen de que la vacuna le causa la infección y en casos extremos que puede producir autismo, y por eso no se vacunan. Nosotros recomendamos que se pongan la vacuna de la influenza, y también a las personas mayores y a los niños pequeños se le pone la vacuna del neumococo, que es una infección por bacteria que puede traer serias complicaciones. Es bueno tener esa protección, pero desafortunadamente no protege contra el coronavirus, pero sí puede proteger complicaciones como infecciones secundarias que se presentan en personas que tienen enfermedad de base, del corazón o de los pulmones, o que están en tratamiento con quimioterapia.
Muchas gracias, doctor. Se ha unido a nosotros el concejal Idanis Rodríguez. We have been joined by Councilmember Idanis Rodríguez, and I would like to give him a minute to address the general public regarding this particular issue.
Simplemente que nosotros, creo, el liderazgo del congresista se demostró una vez más, donde nosotros estamos todos coordinados de una forma muy responsable, de nosotros seguir llamando a nuestra persona a tener precaución, pero sin caer en pánico. Bien claro de que todos en algún momento tendremos el virus. La pregunta será cómo nosotros podemos prepararnos para proteger a aquellas personas que más son vulnerables, aquellos que tienen enfermedades de pulmonía, que tienen asma, que tienen obesidad. Así que juntos nosotros tenemos esa gran responsabilidad de decirle a toda nuestra gente de que estamos preparados para apoyarlos a ellos.
En inglés.
We are here, first of all, thank you, Congressman Espaillat, to let all New Yorkers know that, as they have been said before, it's a matter of time when everyone will get the virus. The question is, how much prepared are we? And I think it is important, again, that we take all the precautions necessary without getting into the panic. But I feel that what we have seen over and over with the expansion of other individuals getting into the virus, we need to be ready. As a city, and I think what we're doing today, bringing the experts and the elected officials, the public and private sector, with one message. Let's be one city together to support those who need it the most.
Thank you, Councilmember Idanis Rodriguez. Doctor, I wanted, the Assemblywoman mentioned the help that the city is providing for small merchants. La asambleísta habló sobre la ayuda que la ciudad le está proveyendo a los pequeños negocios. ¿Puede compartir con el público cuál es eso?
Certainly. We just announced, the mayor just announced today that we are seeing, as it was mentioned before, a disproportionate hit on small businesses. And small businesses are at the core of our economy in the city, the livelihood of a lot of people in the city. And with more people staying home and telecommuting, of course, we're going to see consequences. We are seeing already consequences. So going forward, if you have a business with less than 100 employees, you can actually get either grants of up to $6,000 or 0% loans up to $75,000 to actually get through a period of time. We don't believe that this is going to stay with us forever. It may be a few months, and we want to make sure that we help every New Yorker the best way possible. Para los pequeños negocios, el alcalde anunció hoy que va a haber un programa de ayuda porque son la base de nuestra economía, entonces queremos que ayudarlo lo más posible. Entonces puede haber dos tipos de ayuda para compañías que tienen menos de 100 empleados. Puede haber préstamos con un 0% de interés hasta de $75,000 para empresas, para ayudar a empresas a que sigan operando, y aparte también grants de hasta $6,000 para las mismas empresas, menos de 100 empleados.
Okay, the next question from our audience is there a possibility that we will get areas of New York quarantine, and are we confident that critical products will be available in that case? La pregunta es que si espera que algunas áreas de la ciudad de Nueva York van a estar en cuarentena y si podemos asegurar de que productos importantes van a estar disponibles. Doctor, would you like to answer that?
Well, whether quarantine procedures are implemented or not, it's going to be up to the city health officials. But I think what I would say is that, in my view, looking at how New York is currently prepared and looking at the history of what happened in Wuhan, China, or what happened in northern Italy, there was a period where there was lack of transparency, lack of information distributed to the general public, and the outbreak became rather explosive, and therefore the situation became very bad in those places. I think New York is in much better position. It's not likely to result in the same type of outbreak that we witness in those places. That said, we are going to have more cases. I think that's already been articulated quite clearly here. But hopefully it won't reach that level that massive quarantine is applied.
En español.
Estoy de acuerdo con el doctor Hawk. Dice que la realidad es que lo que estamos viendo en China y en el norte de Italia es muy diferente de nuestra realidad aquí, porque lo hemos manejado diferente. Lo que pasó allá es que no había transparencia, las autoridades no estaban proporcionando información y la situación creció por falta de comunicación y se transmitió mucho más de lo que ellos admitían. En nuestro caso acá, lo que posiblemente, por cierto, ya tenemos dos formas de cuarentena. Uno, pero son para las personas que están los casos confirmados, y hay otro tipo que no es cuarentena, pero es un aislamiento voluntario, en el cual las personas que son asintomáticas, pero que de alguna manera estuvieron en contacto con alguien que puede o ya es confirmado, deciden ellos voluntariamente a trabajar desde casa para proteger a los demás, y eso se me hace lo más responsable.
Gracias. La próxima pregunta es, the next question is, a constituent that's diagnosed with lupus asks, can permission to work from home be requested in cases like mine, since I take medicine to suppress the immune system? Una persona que sufre de lupus, que si puede trabajar desde la casa porque toma medicina para tratar su condición. Anybody would like to join in?
Okay. I can tell you that again. The situation is with your employer. Two things. There is a law for paid leave that at least gives every New Yorker 5 days of paid leave. So this is something that you need to address directly with your employer. But it's not because you have symptoms, it's to prevent and to protect you from being exposed. But obviously, you know, if your employer is saying no one is infected in the workplace, I think that's something that you need to resolve with.
And some companies have already taken the measure to allow their workers to work from home, but that's an individual decision that's being made by each of those companies. Algunas compañías ya han tomado medidas de dejar que sus empleados trabajen desde la casa, pero es una decisión muy particular de la empresa. Councilmember, you want to join?
Yo lo que creo es que declarar a Nueva York en estado de emergencia también debe incluir, y yo creo que in the next few days things changing every hours, and I think it's a good question. I think that to declare New York State as the state of emergency, I said no, it's been done. What I said, this type of question and concern, people should not use the basic day for that purpose. I think that it is important that we have the basic day. But I feel that this question also is something that we should get the state and the city, you know, from the speaker to the mayor to come to the table. Can we establish as emergency direction to say we are calling for the public and private to accommodate for people to work, not only to say that people should do it, but can we give a direction that this is how, in this moment, someone who is dealing with that type of illness, they should be able to work for home.
Okay, the next question is, what will happen with mortgage payments and other financial responsibilities if people cannot go to work due to quarantine? ¿Qué pasaría con los pagareces de hipotecas o cualquier otra responsabilidad financiera si la persona no puede ir a trabajar? ¿La ciudad a lo mejor puede decir algo?
This moment, I think we should be working on something like that. We want to help New Yorkers as much as possible. As I said, at least you have 5 days of obligatory paid leave, and then we need to understand what we do with the next 7-8 days to complete the 14-day that we are proposing for quarantine.
One point for the people who are in quarantine, we have 19 now who are mandatory. The Department of Health will provide food to you, bring it to your door if you need it. They'll bring prescription medicines to you if you need it. There's another 2,200 people who are on voluntary quarantine, maybe because they were traveling somewhere. We have a really good system for the short-term needs of people who are enclosed at home. But as the Deputy Mayor says, there could be economic implications that we probably have to start preparing for long-term.
We will try to set up another update like this broadcast for next Friday, March 13 at 7 p.m. So stay tuned. All of you stay tuned in social media. We will continue to communicate with you via this route through Manhattan Neighborhood Network. We would love to continue to have a dialogue with you if you have any questions. I don't know if there's any additional questions. At this point, maybe we would like to hear again from Councilwoman, our local Councilwoman, Diana Ayala, who I know is very vested in making sure that her district understands really well what's going on. Councilwoman, any parting words?
Well, I mean, yes. I again, as a member, you know, I'm also, you know, I live in this community. My children go to the schools in this community. I feel confident that my children, you know, are in a safe environment. Yo vivo en esta comunidad Soy madre, tengo niños que van a la escuela pública en esta comunidad y me siento tranquila que todo lo que podemos hacer, estamos haciendo para asegurar que nuestros niños estén en un ambiente saludable durante el día. But, again, we cannot stress enough that while most of us will get sick and we will be fine, that we need to just be very careful for not only the older adults, but even younger citizens, children that have illnesses, because children sometimes do have cancer as well. And so we want to make sure that if that is the case, that we're just taking every precaution, but just please wash your hands, cough into your wrist, do not cough into your arm, and if you cough into something, wipe it down. Try to keep, that area sterile and as clean as possible.
Assembly member, any quick parting words? 30 seconds.
Continue to follow MNN and for next week for updates, because as the council member said also, things are changing constantly and we're trying to rebound, but on the short end, we're in a great space. Don't panic. Take this information and share it.
Assemblywoman, real quick, 30
The
seconds.
same, we are just asking our communities to stay informed. Nuestra comunidad debe de mantenerse informado. Es importante que su información venga de una fuente confiada, como sus oficiales electos. Así que, por favor, siga sintonizando para más información.
I want to thank Manhattan Neighborhood Networks and the panelists and the elected officials here. In Washington, we allocated $8.3 billion that will go to addressing this crisis. We're pushing hard to ensure that testing gets done rapidly, that test kits are distributed throughout the country, that the hospitals and the healthcare institutions are equipped with what they need to address the needs of Americans across the country. We'll continue to communicate with you. We thank you for tuning in. Le damos las gracias por sintonizar al Manhattan Neighborhood Network. Si alguna pregunta no fue contestada, vamos a tratar de contestársela. If any question was left unanswered, we will try to get back to you to answer this via the internet, via the social media. But we really want to thank you for tuning in. Remember, information is power. It will keep you safe, and it will keep you abreast of everything that's going on regarding the coronavirus. It's important that you stay educated, that you inform your community as to what your rights are, what is the actual condition of the city regarding this particular crisis. I thank all of you, the Deputy Mayor, Dr. Hall, the Chairman of our committee, the Health Committee, and of course, Dr. Tapia Mendoza and the rest of the elected officials. God bless you and keep the faith.